Assalamu alaikum. I am Ahmed Ra'ad Zaki, General Anatomy Final Report. My final report about sensory and motor innervation of the tongue. Firstly, introduction of the tongue. The tongue is a muscular structure that forms part of the floor of the oral cavity and part of the anterior wall of the oropharynx. The tongue is mass of striated muscle covered with the mucosa membrane, divided into right and left by median septum. The tongue has three parts: the oral parts, anterior 2/3, and pharyngeal parts, posterior 1/3, roots, base, and two surfaces, dorsal surface and ventral surface. You can see on this picture oral part of the tongue and the pharyngeal parts and base. Dorsal surface of the tongue divided into anterior 2/3 and posterior 1/3 by V-shaped sulcus terminalis. The apex of the sulcus faces backward and is marked by pits called the foramen cecum. Foramen cecum, an embryological remains, marks that site of the upper end of the thyroglossal ducts. Anterior 2/3 of the dorsal surface have three types of papillae: filiform, fungiform, and villate. Posterior 1/3 non-papillae because of underlying lymphatic nodules, the lingual tonsil. You can see in this picture foramen cecum on the apex of the sulcus terminalis. This is the sulcus terminalis, V shape. And you can see three types of the papillae: filiform, fungiform, and villates. Ventral surface of the tongue: smooth non-papillae. In the midline anteriorly mucosal fold frenulum connect the tongue with the floor of the mouth, called lingual frenulum. Lateral to frenulum, deep lingual vein can be seen through the mucosa. On each side of frenulum, small papillae has opening of the duct of the submandibular gland. A round ridge extending backward laterally from the papillae is produced by the sublingual gland. You can see on this picture sublingual gland, and this is the duct of submandibular gland. This is the lingual frenulum, connect the tongue with the floor of the mouth, and this is the lingual deep vein. Sensory supply of the tongue: anterior 2/3 of the tongue division to general sensation and special sensation. The general sensation of the tongue supplied by lingual vein is one of the sensory branch of the mandibular division of the trigeminal nerve. Mandibular exit the skull base by the foramen ovale. The mandibular division of the trigeminal nerve divides in the infratemporal fossa into the auricular temporal nerve, inferior alveolar nerve, and lingual nerve. Posterior division. Lingual nerve located proximally 1 cm anterior to the mandibular foramen. Passes the lingual nerve below the lateral pterygoid muscle. Enters the oral cavity at the level of mandibular third molar. You can see the trigeminal ganglion and the foramen ovale. This is the mandibular foramen, the lingual nerve anterior to the mandibular foramen, and this is the lingual nerve, buccal nerve, mental nerve. When you remove this bone in other picture, you can see the pterygoid muscle. The lingual nerve passes laterally on this muscle. Lingual nerve injury. Pain and sensory change due to the lingual nerve injury are one of the most common alterations that follow surgical removal of third molar. They are usually transient, but other less common complications such as the atrophy fungiform papillae. Anterior two-thirds. Special sensation supplied by the chorda tympani nerve, which is a branch of the cranial nerve, facial nerve, transmits taste sensation to the anterior two-thirds of the tongue, passes medially to the tympanic membrane and the handle of the malleus, and again enters the temporal bone, exits the cranial cavity through the internal acoustic meatus, along with the facial nerve, descends in the infratemporal fossa medial to the lateral pterygoid muscle, joined with the lingual nerve, and is then distributed the anterior two-thirds of the tongue. You can see on this region the internal acoustic meatus. This is the facial nerve, and this is the chorda tympani nerve. Passes on the pterygoid muscle. This is the lingual nerve, joined with the chorda tympani and distributed the anterior two-thirds of the tongue. The preganglion fiber of the chorda tympani snaps with the postganglion fiber, which go on to the innervates the submandibular and sublingual salivary gland. You can see sublingual gland and submandibular gland. This is the preganglion fiber. This is the chorda tympani. This is the lingual gland. and this is sublingual gland. Chorda tympani nerve injury. The chorda tympani nerve innervate lingual taste bud and is susceptible to damage during dental and inner ear procedures. Interruption of the chorda tympani result to disappearance of the taste bud. Sensory nerve supply. Posterior one-third. General and special sensations supplied by glossopharyngeal nerve. Glossopharyngeal nerve along the other two cranial nerves. Leave the skull through jugular foramen. Descend along the stylopharyngeus muscle. At first behind the internal carotid artery, and then between the artery and the internal jugular vein. Passes between the superior and middle constrictor of the pharyngeal muscle and enters the oral part of the pharynx, reaching the root of the tongue, where divided to lingual branch. The lingual branch of the glossopharyngeal nerve innervates the mucosa of the posterior one-third of the tongue. You can see the glossopharyngeal nerve and the jugular foramen. Leave the skull from the jugular foramen. And this is the stylopharyngeus muscle. And this is internal carotid artery. And this is the pharyngeal muscle. The glossopharyngeal nerve passes between the superior and middle constrictor of this muscle. And this is the internal jugular vein. This is the internal carotid artery. And this is the glossopharyngeal nerve. This is the hypoglossal nerve. Injury of the nerve. Damage to the glossopharyngeal nerve can result the loose taste sensation to the posterior one-third of the tongue and swelling. Sensory nerve supply. Base of the tongue. General and special sensation supplied by internal laryngeal nerve, branch of the superior laryngeal nerve, the branch of the vagus nerve. Leave the skull through jugular foramen. Arises from the middle of the inferior ganglion of the vagus nerve. It is within the jugular foramen. It is larger than superior ganglion. Passes under sternothyroid deep to the superior thyroid artery. This is the vagus nerve, and this is inferior ganglion of the vagus nerve. Inferior ganglion of the vagus nerve and the superior ganglion. This is the internal laryngeal parts, and this is external laryngeal parts. On this picture you can see the vagus nerve and internal laryngeal nerve passes deeply to the superior thyroid artery. This is the superior thyroid artery, and this is the internal laryngeal nerve. Injury of the nerve. The major risk for injury is thyroid surgical. Superior laryngeal nerve injury is more difficult diagnosis than the retrolaryngeal palsy. Muscle of the tongue. Intrinsic muscle and extrinsic muscle. Intrinsic muscle confined to tongue, no bony attachment, consists longitudinal fiber, transverse fiber, vertical fiber. Function of it give the shape of the tongue. Extrinsic muscle connect the tongue to the surrounding structure, the soft palate and the bony mandibular, hyoid bone, styloid process. Include the palatoglossal, genoglossal, hyaloglossal, styloglossal. Function help to move the tongue. This is the stylo process. This is the stylohyoid ligaments. This is the styloglossus. This is the hyoglossus. Hyoid bone. Genoglossus. Motor nerve supply. Intrinsic muscle supply by hypoglossal nerve. The hypoglossal nerve is the 12th cranial nerve. If the nerve has purely somatic motor function, innervate all the intrinsic muscle, arises from the hypoglossal nucleus in the medulla oblongate of the brainstem. Hypoglossal nerve exits the cranium by the hypoglossal canal, passes inferior to the angle of the mandible, crossing the internal and external carotid artery, and move in anterior direction to anterior the tongue. You can see the medulla oblongate. This is the medulla oblongate, and this is the hypoglossal canal. The hypoglossal nerve. This is the external and internal carotid artery, and this is the genoglossal. This is the hypoglossal nerve. The hypoglossal nerve can be damaged in the several ways. Strokes are common causes of damage to this nerve, often inability to speak properly is due to the hypoglossal damage. Other causes of the damage are tumor on the brainstem and multiple sclerosis. Motor nerve supply, extrinsic muscle, all supplied by the hypoglossal nerve except the palatoglossal. The palatoglossal supplied by the pharyngeal plexus network of the nerve fiber. Innervate most the palate and the pharynx. Location with the external facial of the pharynx and the medially pharyngeal constrictor on the posterior lateral wall of the pharynx. The following of the pharyngeal plexus, pharyngeal, glossopharyngeal nerve, branch, pharyngeal branch of the glossopharyngeal nerve sensory, vagus nerve, pharyngeal branch of the vagus nerve motor, cervical sympathetic fiber, vis motor. This is the vagus nerve and this is the pharyngeal plexus nerve. This is the glossopharyngeal nerve. This is the carotid branch. This is the pharyngeal branch. Thank you.